Are you considering utilizing medical cannabis for one of your state-approved medical conditions? If so, we understand firsthand how overwhelming and sometimes confusing this can be for first-time cannabis users. This, in my opinion, is primarily due to the overwhelming number of strains of cannabis, right? There's more than 700 strains out there, and they have very creative names, none of which give insight into what they may or may not do, or what kind of effects they would produce. Another issue has been the restrictions the federal government has placed on cannabis with regards to research. So unfortunately, there's very little peer-reviewed medical research available for each condition that it's approved for, based on the state that you live in. So, although there's a lot of anecdotal evidence, the medical research is still lagging behind. And therefore, I feel a lot of healthcare providers don't feel adequately trained to be able to provide some guidance for patients when considering this trial. So hopefully this video will at least give a little bit of education for cannabis beginners out there, and will make you feel a little bit more comfortable when you're first going to the dispensary. So when I talk with patients about utilizing cannabis, there's two big topics we want to cover the first time. So first is what you're using, and then how you're using it. So as I alluded to, there's hundreds of strains of cannabis out there, and each of them have different amounts of CBD, THC, as well as different terpene profiles. All of this is important with regards to the desired effect that the cannabis product will create. However, it's impossible to understand all of these different options when first going to a dispensary or first trying cannabis. So although it's not 100% accurate, I will break down cannabis into three big groups for my patients, right? So you have indica, sativa, and a hybrid. Indica is a type of cannabis plant that will cause you to be a little bit more sedated, can help you sleep, and maybe a little bit more euphoric effect. So indica is primarily used later in the day or evening, especially for patients who have difficulty sleeping, or say their pain keeps them up at night. But very seldom, if ever, should be used during the daytime. For daytime use, we have sativa, which again is a type of cannabis plant or flower, and then we have hybrids. So for patients who have no experience with cannabis and no prior exposure to THC, we obviously have to be careful with regards to what we recommend, especially those who are still working, caring for young children, have to drive on a routine basis. So in those situations, we're really going to rely on a hybrid formulation initially with higher CBD, lower THC. This allows two things. So first, it allows the patients to kind of acclimate to cannabis, allows their body some time to build up a tolerance to the amount of THC that they're exposed to, and it also prevents any potential side effects, and then will be a foundation from which we can work to adjust the amounts of CBD and THC in the products moving forward. Again, because there's very little evidence and research out there available for your specific condition, for instance, chronic pain due to disc herniation, no one knows exactly the type of strain or the amount of CBD or THC you need. This is much different than what we've become accustomed to with regards to medication, whether you take a 600 milligram ibuprofen pill 3 times a day, or 600 milligrams of Neurontin 3 times a day or every 8 hours. So this is very different. So you do have to have some patience when first utilizing cannabis or going down the road of a trial, especially for daytime use. Again, nighttime, start with an indica product, daytime. There's sativa, which may be a little bit more activating or energizing type effect, shouldn't cause as much sedation theoretically. And then there's hybrids. So for patients who have no prior exposure or experience to THC and have to remain functional during the day and can't afford any potential side effects, I would recommend utilizing a hybrid, higher CBD, lower THC, at least to begin, and then we can work from there to make adjustments. Then we want to talk about, well, how do we use it, right? So there's many different formulations and ways to ingest cannabis. We're not going to cover all of them today, but a couple of the common ones would be capsule, tincture, which is drops under the tongue. There's edibles, and then you can inhale it, whether a vape or smoking the flower itself. Really kind of deciding what route is best for you is really going to depend first on preference, different medical comorbidities, and then the type of condition we're trying to treat. So for instance, some individuals want to avoid smoking, which is perfectly fine and for many advisable. So right off the bat, we're looking at routes that don't involve inhaling the cannabis product. Comorbidities that we should keep in mind, right? Patients with chronic lung issues, whether COPD, emphysema, chronic bronchitis, or other pulmonary complaints, we may want to avoid inhaled routes as well. People with gastrointestinal issues or previous surgery that may affect absorption of an oral route, such as like a capsule or an edible. Again, these are things to think about. In individuals who smoke, smoking does cause vasoconstriction or narrowing of the blood vessels, right? So drops under the tongue, we do rely on the blood vessels under the tongue to get the product absorbed into our system. So smoking could theoretically cause an effect on absorption. Once we take those factors into consideration, then we want to know, well, what type of condition are you looking to treat, right? So for instance, if you deal with chronic pain, condition that for most individuals cause you to experience discomfort throughout the day, no matter whether morning, afternoon, or evening, we really want to rely on a longer acting formulation. So we want something that kicks in not too long from the time that you take it, but is going to last many hours. So when you look at the different options, right, capsules probably last the longest, right? Most individuals, at least in my experience thus far, are utilizing a capsule twice a day, possibly. Tinctures, which are, again, the drops under the tongue, usually last about 4 to 6 hours. So another good option with regards to individuals managing a chronic issue. Edibles last for a few hours as well, but this is a very individualized response and not something I would recommend for my first-time cannabis users, but something that as you get more familiar and experienced with the process, something that could be considered. And then there's inhaled routes, right? Inhaled routes will kick in quick, but only last an hour or two. So you can see that this might not be the best way to take in cannabis from a chronic pain standpoint, or a condition that is going to rely on coverage for longer periods of time throughout the day. Some individuals prefer the inhaled route. However, this is one reason why the cost of utilizing cannabis on a weekly or monthly basis can get a little higher or more costly, because if you're relying on such a short-acting product, you have to use it more frequently throughout the day. Hence, buying more product, it can get more costly. So I would recommend, if you deal with a chronic condition, you should look at longer-acting formulations, whether a capsule or a tincture, and rely on the short-acting inhaled routes only for what we would term kind of breakthrough pain or incident-type pain, if you do something and the pain increases. On the flip side, if you deal with anxiety or a condition that is infrequent but severe at times, well, you may want something that's faster onset and quicker quicker to kind of get out of your system, and then maybe an inhaled route might be useful for that indication. I hope this information helps. Again, this is just the foundation from what we're going to build on moving forward with the use of cannabis. For completeness sake, when you're at the dispensary, you may also hear of terpenes. These are going to be very important and something that I recommend my patients as we go through this trial that we learn more about to figure out what terpene profiles may be beneficial for your condition as well. So again, hope this helps. And if you have any questions, please feel free to reach out to Pain Consultants USA on our social media or our website or our emails. We're here to help. Have a good day.